This event was brought to you by TG Therapeutics.
Company that manufactures Briumvi, and I wanted to come down here and just share a little bit of that info with you guys. So thank you for taking time out of your busy day to come hear about it. But Dr. Cruz has come down here to speak with you all. I know most of you are some of his patients, so you know him very well. But he works out of DHR and heads up the EMS center over there, so he treats a lot of folks with multiple sclerosis and a few other disease states as well.
Again, please feel free to stop me at any time, and I'm more than happy to answer any questions. English or Espanol, I'm good, so I'm more than happy to. So today we're going to be talking just a little bit about the MS, just very general concepts of it and on what is the disease, what to expect, and all that. Every time a new MS medication comes to market, it requires a lot of work. So it requires a lot of clinical trials, a lot of brave patients like you that help the MS community try it for the first time and to try to see if it's safe, if it's effective, and to see also if the long term, because sometimes when you study a medication at the beginning it looks very good, but then you keep looking at it and then it's not sustainable, either because of side effects or maybe it's maybe the therapeutic effect, meaning how good it is in controlling symptoms or the disease might not be something long lasting, but we're going to go over the data of it. So again, this program is sponsored by TG Therapeutics. Here represents TG Therapeutics. So thanks to them, we're going to be here. Okay, so I think by now a lot of you know what MS is. So MS is an autoimmune condition. At the beginning when MS actually was studied as a disease, it was thought that it was an infection. Because when they were seeing the inflammation that was happening in the brain, it kind of looked like the inflammation that you will see in people that are having a bacteria of a virus. Of course, throughout the years, it was discovered that that inflammation was the immune system attacking yourself, right? So it's an autoimmune condition that affects the central nervous system. When you hear people saying central nervous system, just think central. What's in the middle? The brain and the spinal cord. Sometimes people, when I know you probably have gone through this, when you say oh, I have been diagnosed with MS, or my loved ones have been diagnosed with sclerosis, they will think ALS, because there are a lot of types of sclerosis. But multiple sclerosis, the name came about again just because of how the lesions look in the brain. It kind of looked like a plaque, the French neurologist that described it thought that it could be basically a plaque and name it sclerosis. So that's how it is. And it can affect the multiple areas of the brain, the spinal cord, the central nervous system. That's the name, multiple sclerosis. Now, this is basically result from a study that came out in 2017. Before 2017, there was an old study from 1981. I was born in 1984, so this is long time ago, right? So it was saying that around 400 people were living with MS. Now in 2017, it's close to 1 million, right? So that tells you that it's something that it's real, it's with us. One key thing that I actually just started looking into, looking at the history of MS. We do see that it seems that the first MS patients came from Europe. But I think nowadays, we are a mix of different ethnicity and races, right? But now we see MS across all races and ethnicity. It's a disease that does not discriminate, and this is a little bit. Now, it is 74% female and 26% male. Why? We don't know. We don't know for sure. Genes might be something to do with, but also hormones also can be something that is kind of maybe have been linked to it as well. But the reality is that we don't know why females tend to be more affected than men. Okay, now, what is our goal when we're treating multiple sclerosis? So, every time we go to conferences, whenever or we look at clinical trials, we're looking to something that is called NIRA. NIRA is basically not evidence of disease activity. What does that mean? What we're trying to do with our medications is to stabilize it. And that's what NIRA means.